and gentlemen, I did another article, and there's a lot of people that feel the DEA is really useless. They've been around for 50 years and they have not put a dent in drugs coming into the country or drug trafficking or drug dealing. They have not put a dent in any of this stuff. And many feel that the agency really should not exist anymore. But let's take a look at this article that came out September 17th, 2018. And this came out in Health Lab. I'll leave the link to this article in the description box. Despite DEA limits on opioid prescriptions still rose. A new drug policy was meant to curb unnecessary opioid prescriptions. Instead, a new study finds prescriptions after surgery went up. And this was the DEA's idea, was to put restrictions on prescriptions. And as you can see, this is one more failure that they have put in place. As the nation's opioid plague worsens, the Federal Drug Enforcement Administration placed some prescription painkillers in a tougher to fill category. While the step was well intended, it may have led to more opioids, not fewer, being given to patients by surgeons after routine operations. The DEA's 2014 action to move opioid painkillers to a more restrictive class was not correlated with a drop in prescribing following elective procedures, as we would have expected, says Jennifer Walge, MD, a Michigan medicine plastic surgeon who also co-directs the Michigan Opioid Prescribing Engagement Network. In a study in JAMA Surgery, Wilge and her team observed that the amount prescribed rose under the new law, despite some stringent regulations. Although the reason for this are not clear, it is possible that prescribers were concerned about inadequate pain control and difficulty obtaining any needed refills. Opioid use for post-operative pain control is thought to be a major gateway to addiction. In their research, Walge and her colleagues at UM's Institute for Healthcare Policy and Innovation tracked opioid prescription patterns before and after the DEA's ruling that moved hydrocodone, Vicodin, the most commonly prescribed opioids after surgery, from Schedule 3 to the more restrictive Schedule 2. The change meant that doctors could prescribe only a 90-day supply, and they couldn't subscribe by phone or fax. Data on nearly 22,000 privately insured patients in Michigan undergoing common surgeries, such as knee replacement and cancer treatment, showed that the number of hydrocodone prescriptions actually rose after the new rule. Although prescription refill rates went down, the number of opioids filled increased by 7 tablets per patient after the DEA's change. The effect of these policies cannot always be predicted. Okay, it's possible that these restrictions limited the ability to prescribe extra pain medication after patients are discharged if needed. In the absence of data regarding how much patients actually use, prescribers may have prescribed more upfront to avoid the risk of patients running out. Just how many pain medicines a patient will need to help with post-surgery recovery has always been murky. Surgical teams have lacked an evidence-based guide to help gauge the amount needed for acute pain. To help Michigan surgeons develop an opioid prescribing tool in 2017 that lists prescription amounts for 11 common operations, which each recommendation supported by surgical quality research, plus patient data and surveys. Further, opioid related policies and regulations should include a similar research based approach and close follow up to determine if they're working, the research team said. Likewise, the approach ought to be a collaborative. Different types of physicians and health professionals should be involved in the policy making surrounding opioid prescribing, especially for prescribing in different settings. Our work suggests patient and physician education about opioids is critical. Okay, so the DEA put restrictions on how many scripts a doctor can give out to a patient. See, if they gave out too many, they can come in there and arrest the doctor. But as you can see, this is another policy the DEA put in place, and it really failed because ultimately people ended up with more opioids after they put these new policies in place than less. So it didn't work. And it's not going to work, ladies and gentlemen, because number one, until you do something about the drug addict, nothing that you do is going to make any difference. As long as they keep letting these addicts just stumble around looking for drugs or faking an illness and injuring their pets for drugs, nothing is going to change. So they have decided to give immunity to these drug addicts. And when they made that decision, they have become enablers of the problem and not helping the problem at all. And it doesn't make a difference anyway. Even if you curb these drugs, there's still the illegal street drug that many of them are turning to. I was even reading an article where more elderly people are turning to street drugs. So as long as the flow of drugs are coming in through all the borders across this country, you are not going to see a change in the drug addiction. That should be common sense. But I guess it's not. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I will see you on the next video. Peace, family.